Welcome to the next session, which is on migration, long-term resilience and long-term care or social care. We've already had the beginnings of some conversation about that in the previous session, looking at the intersection between healthcare and social care or long-term care. And I think that goes to show that when you're taking a systemic approach, actually these kind of sectoral divisions, it challenges these sectoral divisions. So we have two papers and one respondent for this session. So let's just go straight into it, and I introduce you to Franca van Hooren from the Department of Political Science at the University of Amsterdam. Franca, the floor is yours.
Thank you, Bridget. Let me share my screen. Okay, so thank you very much, Bridget and Martin and Friedrich, for giving me the opportunity to speak here. I think the topic of this initiative is really great and called for. And I also, as you just said, Bridget, I saw a lot of interesting things being raised already in the previous session on healthcare. So I think a lot of what I will say will resonate also with what Steve Thomas and Isabella Buttering and Jim Campbell have said there. Let's see. Yeah. So I want to address two questions in this presentation, namely how has reliance on migrant workers related to the resilience of social care provision during the COVID-19 pandemic so far? And here I really want to give just a few observations based on newspaper articles and the few first reports that have been coming out on this topic. And then I'll also give some indications of what public responses have been to the situation that has emerged. And there I mean both political responses and the kind of media responses that we've seen. And in this presentation, I'll focus very much on Western Europe, realizing that that's a very limited geographical scope. And I focus on long-term care for the elderly and disabled. Primarily, there is a bit of a blurring and overlap with what some people might call domestic work, meaning really the direct employment of a worker to provide private care services. Okay, so before going into these questions, I wanted to just very briefly give you a little bit of context. And that is that there are important differences in the reliance on migrant care workers across Europe. And this variation is shaped by an intersection of care regimes, employment regimes, and migration regimes. And generally speaking, you find the fewest migrants employed in social care in countries in which there's strong public investment and public organization of social care. Which basically means that in these countries, social care is a type of employment that is sufficiently attractive for native workers. And this used to be the case, especially in Northern Europe, also in the Netherlands. But I think you can say that due to funding cuts and marketization trends in these sectors, that basically this situation is hardly to be found anymore in Europe. So these cutbacks in funding and marketization of care have led to increased demand for formally employed migrant workers. So migrant workers in institutional settings, in nursing homes, or employed by home care providers, because they offer a cheap and flexible workforce, basically. And this you see in particular in the UK, about which I think we will hear much more in the next presentation. And also increasingly in Scandinavian countries. So that's one kind of employment of migrant workers, the formal employment in institutional care. And then the other type that you see a lot across Europe is the direct employment of migrant workers by families. And this happens especially in the absence of public care provision, or where there are cash for care benefits that are not otherwise regulated. And this direct employment of migrant workers by families you see in Germany, Austria, and across Southern Europe. And these migrants also often work informally. In terms of migration regimes or migration policies, what is noticeable and also maybe different from the healthcare sector is that very few migrants are actually in social care are employed through a work permit. Instead, you see a lot of intra-EU mobility, especially since EU enlargement in the 2000s. And you also see reliance on family migrants, on refugees, and a lot also on undocumented workers. So I briefly wanted to say a few things about resilience of social care in times of crisis more generally. And there are a few interesting differences, I think, between the 2008 financial crisis and the current pandemic. And overall, I think the financial crisis really undermined the resilience of social care. This period being really also a fiscal crisis for many European states. This led to cutbacks across the board, but also very noticeably in social care, which in turn then encouraged further marketization, decentralization, and a return to the family being the main care provider. And at the same time, these very families had a decreased ability to finance privately purchased services on the market, to purchase services on the market. The COVID-19 pandemic then, in turn, I think, really exposed these vulnerabilities of this marketized, decentralized, fragmented, and informal care systems. And I will show you some examples there. But what is really striking here is that this time the state is really seen as the solution. So in the 2008 crisis, it was maybe seen more as the problem, and now it's the solution. There's much more an expectation that the state should step in to resolve some of these problems that have emerged. So and now I'll highlight a few specific issues related to the employment of migrant workers in social care and the resilience of this social care. And the first one is very striking and hasn't really been mentioned yet, I think, today. And that's the reliance on mobile migrant workers. And what I mean here is what is common practice, especially in Germany and Austria, and to some extent also in northern Italy, namely that migrant workers work maybe for a few weeks and then return home to their, for example, to Romania, Slovakia, Slovenia, Poland, and maybe then another migrant takes up this position as care worker. So it's rotating and it's very temporary. Now, this led to immediate urgent problems in social care provision in Germany, Austria, and northern Italy, because these care workers just simply couldn't cross the border anymore during the first lockdown this spring. So many of them returned home, and especially if they were employed informally, which is often the case still, after that they were just not allowed to cross the border. So here I show a newspaper article from the ZDF, or a news item from the ZDF, which refers to this, crisis, corona crisis in the Pflegesystem, in the social care system after the Angst vor Ostern, so the idea that after Easter all these care workers had gone home and they wouldn't come back anymore. And the fear was really that this would lead to a shortage of hundreds of thousands of migrant care workers in Germany. So that's the very visible, very urgent problem that emerged. A more general consequence has been really this the exposure that it became much more visible, how strongly care relies on precarious informal migrant workers. And so different from the specific situation in Austria and Germany. In most countries, these migrant workers continued to be available for work, but often they actually could not go to work because of mobility restrictions, in which case they often did not have an income. They could not rely on any forms of social protection because they are often employed irregularly. So while countries actually created all kinds of emergency protection for formal workers, the informal and undocumented migrant workers could, of course, not benefit from that at all. I also saw some instances where this specific situation of undocumented migrant workers, for example, prevented flexibility. And this really made me think of what Steve Thomas highlighted in relation to the healthcare system before. So, for example, in Spain, there was this great emergency in nursing homes not having enough staff. And at the same, there were many undocumented migrant care assistants who did not have work or income and who were very willing to work in nursing homes, but actually could not do that because they did not have the appropriate documents. And the last point here, and that I think is a very important one, is that there have been various sources suggesting that a reliance on temporary or irregular or other kinds of precarious employment actually undermines the quality of care. So, for example, the mortality rates have been higher in nursing homes with more flexible staff than in nursing homes with more permanent staff. These kinds of indications are emerging, which shows that not only is this reliance on vulnerable workers bad for the workers themselves, but it's also really bad for the quality of care that is provided. Now, turning to the public responses, here are again a couple of things that I want to highlight. So first of all, it's really clear that there is an increased visibility of the role that is played by migrant care workers in all these care sectors across Europe. So this news item that I showed before, it says, everyone knows, but nobody likes to say it. Without the illegally employed Polish women, the German care system would collapse completely. So this is now out in the open. This is being said explicitly. At the same time, we see appreciation of care and care work and a series of bonuses and pay rises being enacted in various countries. But this also, then here actually I have a news item from Austria. It says Bleib da bonus, which means stay here bonus for the Eastern European migrant care workers in the country. That was implemented in Austria. But then this title also says that a lot of them actually haven't received this bonus, because that relates to this point on so state interventions trying to pay bonuses and pay rises, etc., to these care workers, but due to the high fragmentation and marketization of these social care systems, it has become very difficult for states to step in effectively. They just don't have this direct capacity anymore in these sectors, or never had them actually in many European countries. So the final point that I wanted to raise is that there have been, especially in Southern Europe, but also in France, calls for regularizations of undocumented migrant care workers. So associated with this increased visibility of the role of migrant care workers, then came a call for, let's also give these people papers. But of course you can ask, so I mean, this is just doing justice to the actual situation, of course, but you can ask whether this really contributes to long-term resilience, because still these are precarious workers and still these are precarious workers. I find it so strange to be just looking at my screen and not seeing anyone in the audience. So this brings me to the following conclusions. if migrants are to contribute to a resilient social care system, it should be based really on a form of permanent and well-protected employment of migrant workers. And I'm saying if, because of course, resilience could also be achieved through other means, through the employment of native workers or maybe enhanced technological solutions, etc. But if there is a reliance on migrant workers, it has to be on a permanent and well-protected base. And we see that here there is a crucial role to be played by the state. And also there's a little bit more, there seems to be a bit of a political window of opportunity here. And you see also in many countries that trade unions, for example, and migrants' rights organizations are really jumping in and trying to use this opportunity. But the question is, of course, how much in the long term are states really prepared to invest in this? And this morning there was this question like, how much do you want to pay for this long-term resilience? And I think that is really the question that is at stake here too. And then finally, what I did not address at all, but what is of course absolutely crucial, is the resilience of care in the sending countries, in the countries of origin of the migrant workers. So this is absolutely something for further discussion. Okay, that's it. Thank you.
Thank you, Franca. That's given us lots to think about. I think that's really kind of interesting and counterintuitive, the idea that precarious workers are actually less flexible. I think that's very useful to think of. And yes, how much are you prepared to pay for it in the end is perhaps one of the fundamental questions. So thank you very much for that. I've got lots of questions. If you have questions, could you please use the chat box and put the question, direct the questions to MPC, and then the questions will be forwarded to me and I can put them to our speakers. So now we move on to Shereen Hussein. Shereen is Associate Director of the Personal Social Services Research Institute at the University of Kent. Shereen.
Thank you very much, Bridget. It's a pleasure to be with you today. I think I'm sharing the screen now or not?
Yes, you are.
Okay, so it's looking a bit weird at my end, but I'm going to try to, here we go. Right, so I'm not going to have a full presentation. I'm just going to have some pointers to discuss, and it's really a pleasure to be here, and it's a very important topic. I'm going to talk about migrant workers in relation to long-term care, specifically to England, and it was really great to hear Franca and to hear the previous speakers as well. And this is a collective presentation with my colleagues from the PSSRU at Kent, particularly Florian Vadin, Agnes Sternpenny, and Irene Saloniki. I will be drawing on particularly two current projects, but also drawing in previous work that I have conducted in the UK. And the first project belongs to a program of work called Sustainable Care, and I'm leading a team on migrant care workers, and particularly in home care in the UK. And it's led by Sue Yendel at the University of Sheffield. And the other is a piece of work that we're doing at the PSSU, which is I co-lead with my colleague Florian, looking at the retention and sustainability of social care workforce, and it's funded by the Health Foundation. So just to give you kind of a bit around the landscape, because the England, I'm talking about England, and England and the UK are quite a bit different in the way that they operate social care. So I'll give you a quick overview of social care in the UK, particularly in England, and the migrant contribution to the English long-term sector. So in England, long-term care, social care, and we are here specific to care for adults over, 18 years old with long-term conditions or other needs, and particularly older people. But the whole sector is both means and needs tested. So to be eligible for funding from the state, you have to be assessed in relation to your needs as well as your income and assets, and thus there is a split in the markets, and there is kind of self-funders who buy their own care, as well as people who receive care or receive budget or receive a care plan through the local authority. And the funding is actually have been decentralized, so there is some funding going from central government, but it's mainly local authorities, which means that there is a diversion in the services provided across regions, which is quite important. So the other thing about the UK is its immigration policies, which have been changing dramatically over the last decade and a half, so say 10, 15 years ago, and how migrants shaped their contribution to the UK and who's coming and who's doing what. So migrants has always contributed quite significantly to the sector. All figures shows that their contribution within the sector is higher than migrant workers in general within the population. But their profile has changed, and that to do with the various immigration policies. You know, the kind of introduction and expansion of the EU, the intra-European mobility that replaced previous work permit schemes, which allowed employers to directly employ nurses, qualified nurses from the Philippines, for example, or Africa to work as senior care workers in residential care. So historically, and it still remains because a lot of people have remained in the UK, you will find the profile of migrant workers within the care home sector, which is residential care or nursing home, is slightly different from the home care sector. And the home care is more reliant on intra-European migrants. You find in the care home sector still kind of residuals of the previous kind of immigration policies. But in general, the contribution of migrants almost remained static, which is quite interesting in terms of proportions. So it used to be 20%, you know, 10 years ago. It's now around the 18% mark. This percentage is much higher in big cities, particularly in London. But within that 18%, the composition has changed dramatically. And this is very important because of course, of Brexit and new immigration policies that will be introduced as early as January, which is just two months shy from now. So migrant has been a big part, but maybe different from what we've heard from Franca around Austria and Germany. Traditionally, they haven't been that mobile. And even when we look at the intra-European, a lot of European migrants came to settle in the UK. That we have few circular migrants. We do have them, and we have new forms of markets coming up, particularly live-in care markets, which I'll touch upon very quickly. But the majority are employed within the care sector, either in care homes or within agencies which provide home care. And I want to set this within the larger context of the long-standing, what we call staff turnover. Retention is a real issue, and job vacancies in England, and it's the social care sector has very high turnover rates, considerably high vacancy rate. And what's interesting, in places where you have high migrant populations like London, you tend to have lower job vacancies but higher job retention, higher turnover. So people do come, but they leave quickly. That's very problematic to the care sector, where, you know, kind of building relationship is really important, and maintaining the training and skills within the sectors are quite important as well. Now, of course, I just hinted to Brexit. So officially in January, there will be a new immigration system introduced, which is almost like the Australian points-based system, not exactly, but very similar, which means that people will be awarded points in relation to their training and qualifications in addition to their salary, which is very problematic in social care. So while we've seen previous research have shown that migrant care workers usually hold higher qualifications actually from their home countries than the British-born workers, the salary issue is problematic because they will not meet the threshold. Very, very few, perhaps working as nurses within the sector or as managers, but in general, that means that a lot of them will not be able to qualify to have a permit or to be awarded visas to work. Now, of course, we're talking about COVID and, within the UK, Brexit and COVID are causing real shocks to the system. And what's interesting is that they're working perhaps in different directions. So just to say that when COVID struck, and as Franca said, the government has stepped in and did quite a few things, not only financially, but they have initiated a recruitment drive and volunteering drive within the health and social care sector. And we've seen from research and anecdotes that a lot of people who have lost their employment in the retail or hospitality has been directed to social care. And we've seen employers saying, oh, we have been receiving huge volumes of application. Issues of training and retention remain, but at least for the short term, we have been seeing a lot of local kind of long-term care labor supply, which is an opportunity, but also we have to think about that carefully in terms of the training, in terms of the long term. And we also seen borders shutting earlier than Brexit, which is quite interesting. So we've seen data from Skills for Care, which they have been looking month on new starters in the long-term care sector, seeing since March a steady decline on the number of migrant workers from Europe coming to work in the sector. So what happened that because of COVID and shutting borders, it's almost the impact of Brexit have been happening a little bit earlier. But what has not been been in the equation is this influx of labor supply, and because of the closure of other businesses and the availability of other people who might be able and might be attracted, including university students who many of them have actually decided to take gap year and are in the market, and some of them have been working. So local market dynamics are really important. What I want to talk a little bit more is about the resilience, and the definition of resilience is really interesting. It's really responding to the shocks, adapting, and also long-term kind of sustaining this to meet the needs. So we have done in the rescue project, we have been doing a survey where we asked long-term care frontline staff about their experience during the pandemic. And what was interesting that we actually didn't see much difference, almost no difference at all between the experience of British workers and non-British workers. That could be because simply we didn't have many migrants actually responding to the survey. We had a smaller, proportionally smaller proportion of respondents. But what was interesting to look at was that we've seen workers in care homes increasing their workloads, while workers in home care declining their workload. And why I'm saying this, because at the moment, migrant workers are more representative in home care, because basically it is something that attracts migrant workers. You work through agencies a lot. But what we've seen with the lockdown and people working from home, that a lot of informal carers decided to form bubbles with their older people and to refuse agency workers to come. And that had definitely implicated on migrant workers. We were not able to capture that specifically, but the news and anecdotally, we have been seeing that. The other thing that has been happening during that period, and perhaps a little bit earlier, is the growth in the live-in market, which is something that is traditionally hasn't been the case in England. So not like Italy, for example, where you have the migrant in the home or in the family model. This is traditionally something that is not kind of interests the British kind of population much, but there has been a growing intake of that form of care. And what we have been seeing through interviews during that period, that a lot of migrants, live-in care workers, decided not to take holidays because they can't go back. So they actually stayed on for a longer period until they were able to move back. And at that time, the informal family, children or friends have stepped in. What we've seen as well, because of the scandals that have been happening in care homes and the unfortunate increase in death rates, that we've seen some anecdotes of family pushing back the decision and older people pushing back the decision to go to care home and instead looking for alternative. And I think sorry, I've moved on without realizing to the next slide, but what we have, what we're seeing is a shifting ground in this market. So if we look at the implications in terms of both kind of short and long term, we've seen that COVID and Brexit almost as opposing forces. So Brexit, we expect from next year that the flow of migrants will be affected tremendously. There are a lot of discussions and lobbying of how to deal with that. There are lots of different ideas. And the policy, people are looking for examples from other countries, particularly in Australia and Canada, where they have in some provinces have some specific visa, sector-specific visa. But we know that the British government is very resistant to this idea of having a sector-specific visa, because that will open up for various sectors, particularly agriculture sector or other low-paid sectors. So at the time being, with the closures of borders because of COVID, we're not quite sure how that will pan out. And it might be there is a period of time where you have an influx of the labor market supply where you can capitalize on and try to think about the temporality that has been happening to a further form of stability. But to be able to do that, you have to improve and enhance the working conditions and the pay and the image of the social care sector. And to some extent, actually, interestingly enough, that during the pandemic, there has been some enhancement of the image of the sector. So even our survey, which shown that people have felt proud that they are doing their care work, they haven't felt like that before. Again, that's only a small sample, because some of them also spoke about them being portrayed as the kind of causing the spread of the disease, because they move from one home to the other and they have had shortages in supplies, etc. A big question within this kind of rethinking of this temporality and stability, and thinking about migrants as well as part of this equation, is to think about the training and commitment and retention, which are all key components of resilience, and how to ensure that there is the right training and to ensure that people who are coming to the sector are committed. And this is something we've seen from previous qualitative research, that migrants has been always seen as very highly committed. They are hard workers. They usually come with high skills. They are able to train and stay in the job. And within that, we would also think about obviously, we know marketization has been happening for years. We know that cash for care has been introduced through personal budget and healthcare budgets. And there is a huge increase in these ideas of having a personal assistant, which is much, provide much larger kind of support than just long-term care, and also now increasingly live-in care. And what we are worried a little bit about is these forces between pushing migrants away from the mainstream immigration channels through Brexit, and the increase in live-in care uptake, and whether that would create a grey market, and what are the implications in terms of exploitation, rights and safeguarding of both the kind of migrant workers but also the service users. And these are really important issues to be discussed. And that links again to the quality of work and services, and specifically to COVID-19. What was interesting in our survey, that we've asked people how did they feel about their preparedness to the pandemic. And a staggering percentage said that they didn't feel prepared enough in terms of the guidance. There were fragmented guidance. They weren't given the enough supplies of equipment. They weren't given enough training for equipment. But at the same time, they said that they have worked the extra mile and their employer have worked the extra mile to ensure quality of work. We couldn't find any much variation in terms of the responses of migrant workers and British workers, but again, that could be due to the small sample. I guess at that moment of time, there is so much shifting grounds and shocks to the system that are happening within England. And we have, when we think about all these shocks, one thing always comes to mind, that you have to improve the quality of the social care workforce in general. You have to invest in the social care workers. And what's interestingly happening regionally, that within the UK, you find Wales, Scotland, Northern Ireland, all going in the direction of registering and regulating care workers, but England still shying from that option. And it's really important to realize that this sector needs improvement as a whole to be able to harness current opportunities and to move from a sense of temporality to a little bit more of stability. And also to realize that migrant care workers will continue to come in different ways, in different forms, through different routes, refugees and family reunion, and how to ensure that this does not move to the grey market. So on that note, I think I'll stop here to take questions and just to say thank you. And I've put in here 2 email addresses because from January I am moving to the London School of Hygiene and Tropical Medicine. So just in case if people want to contact me afterwards. Thank you very much.
Okay, thanks very much, Shereen. I think the question of the consequences of bubbles and also of working from home for social care and elder care provision is a really interesting question. I'll now turn to Marie McAuliffe from IOM. Hi, Marie. Thank you for coming.
Hi, thank you very much, Bridget, and thanks also to Franca and Shereen for their presentations. I have the task of following on and really providing some discussant reflections is how it has been kind of framed. So I'll really try and limit my comments to 5 minutes, looking at social care and the role for migrant workers, and drawing on the work of Franca and Shereen in their presentations, of course. And of course, as many people know, I'm based in Geneva and head up the Migration Research Division, and IOM's work is global. So we will be kind of zooming out a little bit, notwithstanding, the strong focus and very useful focus on Europe. So first, I've got 3 slides, so not very many. And it's really more of a kind of a prompt and drawing on some of the comments already in a quantitative sense that have already been made by Franca and Shereen. A reminder that at the heart of the interactions and the interlinkages with migration and migration systems is immobility. So on the top of the screen there, you can see the Oxford COVID-19 government response tracker data. That's up until the middle of September. And what we can really see there, the very, very steep increase in both internal border restrictions and international. And we may recall it was quite a dramatic time, and we had very, very substantial, the shutters went up and the borders, came kind of crashing down in many respects. We had over 97,000 specific kind of restrictions related to mobility globally that has been tracked. And we have seen, as you can see from the graph in the top left-hand side there, we have seen mobility restrictions really change and come down. But of course, we're now in the second wave in Europe, along with other regions, of course. I'm just focusing in the context of the discussion on Europe at the moment. So we are seeing the restrictions, of course, heading back up as we go into a very substantial second wave. So I've highlighted there, you know, these are the key workers in the acute kind of first wave, if you like. Healthcare workers, aged childcare workers, domestic workers, transportation workers, and seasonal agricultural workers, which of course is key and part of the discussions across the entire day today. Along the bottom, really, the focus on gender is a really very, very important one when we're talking about social care, as we know. I've pulled out some ILO data, which is a few years old, and it was one that we reported in the World Migration Report a couple of years ago. But it's just to really highlight in a very sort of graphical kind of sense that the gender-related impacts do strongly relate to the underlying migration patterns and processes that have been developed over many years. So we can see there that, you know, for high income countries, we've got very high proportions of women domestic workers. And, you know, we do know that there's a very strong kind of gender dimension to social care, not just to domestic workers, of course. I'm drawing on the left-hand side on a really excellent paper that we commissioned a couple of months ago, produced and written by Laura Foley and Nicola Piper. And of course, one of the things that they really kind of draw out is that over a long period of time, care work has become highly gendered and it's also racialized. So often in many systems, it is socially and structurally devalued, which is a really, I think, important point in all of this discussion around resilience. They also highlight some examples of measures that have been taken both at the national level and also the subnational level. So whether that is state, district, city governments and so forth. They include, as Franca in particular had highlighted, regularisation, social protection measures, which is particularly important for undocumented or irregular migrants. Healthcare access has been particularly important in this pandemic, of course. Mobility regimes shifting and changing. And then visa status sort of flexibility, which of course Shereen mentioned in regards to you might have students who might have a cap of 15 hours per week and so forth, and governments exercising flexibility in regards to the need for essential workers to continue to perform jobs, even notwithstanding that some of our essential workers, as was highlighted during the acute phase of the pandemic right at the beginning, they can be undocumented and irregular migrants, highly vulnerable and in very precarious employment situations, but nevertheless essential to the fundamental operations of our societies. This is just a reminder, something that we all know, but it's a reminder put in a kind of like a little infographic here in a forthcoming piece of work that we are producing. And it's really about how immobility is the ultimate international migration disruptor. And it's something that Franca sort of highlighted in her kind of analysis. We have seen a growing reliance on very high levels of mobility within migration systems. And so here we can see that all the way through the migration cycle, the immobility that has stemmed from COVID-19 movement and border restrictions, both international, and this is our focus, but I also acknowledge internal as well, has been a very, very significant aspect when we're talking about disruption and resilience. Now, the last slide. These ones I've really just drawn out from the presentations, but also offering a couple of other different dimensions. Again, the first one, which I think both speakers spoke about, was really the reliance on mobility regimes, and that we are seeing migration systems really rely much more heavily over time on a degree of quite sophisticated mobility, which, you know, we can talk about in the Q&A, I think. The really big, important one that is a little bit understated, I think, it of course cuts through a range of different sectors, but it does relate to social care, is the role of technology and especially artificial intelligence. There has been a real focus on AI in different sectors well before COVID-19, but some are arguing that COVID-19 has intensified the kind of the race or the exploratory nature to try and get AI systems up in different sectors. We're seeing it in agriculture, for example, because of the disruptions to harvesting, that there has been a significant degree of automation in agriculture, but that has been really bolstered through experiences related to COVID-19. The same is the case for social care and the role of AI. We know that Japan has for a very long time been focusing on an aging population, demographic issues, and the need for an aged care kind of bolstering through technology, as how Japan has seen it. With varying initiatives and a lot of difficulties, a lot of challenges in regards to privacy, in regards to effectiveness, in regards to narrow automation and what that actually means for social care sectors. But I think that is a strategic issue that's not going to go away. It's only going to intensify. Shereen talked a little bit about sector-specific initiatives in the context of the United Kingdom and certainly in regards to Brexit. We do know that they can work, but often it relies on political dynamics and other issues that are occurring in regards to, as Shereen kind of mentioned, if we do something for the social care sector, that means that other sectors will be coming and asking for a sector-specific initiative based on their kind of like needs. I would also sort of highlight too that consular assistance challenges for COVID-19 for origin countries has been very, very significant. We commissioned Marla Assis to do a paper for us on the Philippines and repatriation efforts, and she'll be presenting actually in a webinar with us later this week. And this is in addition to the ongoing human rights and labour exploitation issues that many origin countries are already facing. So it has been a real challenge, especially in regards to having stranded migrant workers around the world with limited or no access to social protection, a really big challenge. And lastly, there's a real opportunity to learn from, now I've put climate change, I would probably broaden that a little bit, environmental migration and displacement. Research, and we know that there has been one pillar of that work that has focused on the resilience of systems, particularly preparedness, disaster risk reduction, for example, agency and small island developing states in particular, as well as climate action. And alongside that, the resilience of migrants and communities, such through adaptive measures, investments, transnational investments and so forth. And there is a body of work that stretches back a number of years now that has looked at those issues as part of a broader kind of remit in terms of environmental migration, climate change and displacement. Thank you.
Great, thanks Marie. So I've got some great questions lined up here. I think what I'll do is I'm going to kind of amalgamate and group some of the questions and put them all to you. But as I put them all to you, I'll also maybe ask that there are some which are directed at specific speakers. So the questions that I think are kind of directed to everyone are firstly to do with the nature of immigration. So it would be very helpful if you could tell us, when you're talking about migrants, what actually do you mean when you're looking at your research on migrants? Who are you defining as migrant and how are you defining that? And then, that leads to the question of, if you have people, migrants who are entering under certain sector specific schemes, what happens if they shift, if after having been resident for a few years, they decide that they don't want to work in social care anymore? Is that a challenge for some of your suggestions? So that was the first kind of question for everyone. Second kind of group of questions is really about the nature of status, the low status of social care, and the importance of valorizing it. So how is it possible, if it is possible at all, to change public perceptions of social care? Do you agree that this is important? And perhaps you could respond to some of the conversation in the earlier session about this notion of competences. Is this something that could be usefully deployed with reference to social care? And finally, the role of the state. So there's a sort of state, how important is state oversight, and how is the lack of state oversight actually a weakness in terms of resilience, or does it facilitate flexibility? And what is the role then of local, so we're thinking about national states, but what about local governments, city governments, who are often very involved in care, in the delivery of social care? So those are the kind of top level questions. Perhaps I'll just go ask you to respond to those first, and then I will ask you the more specific individual questions. So we can start with Franca.
Okay, thank you. These are some great questions, I think. So yeah, when I talk about immigration or about migrant workers, I really talk about a broad and category with a lot of variation. So as I said, most of these migrant workers do not work based on the work permit. So this question of are they allowed to move on to different types of occupations is usually not applicable because there never was a work permit in the first place. Instead, there's a lot of intra-EU mobility. So a lot of the migrant workers are European citizens. There's a lot of undocumented migration, especially in Southern Europe. And then in countries like Sweden, for example, you see quite a few refugees working in nursing homes and family migration. But of course, you should realize, of course, that the situation of family migrants is completely different from the situation of undocumented migrants or the few who are working based on a work permit. So I absolutely agree that it's important to be specific about which kinds of migrants we're talking about. Yeah, the point of low status, that was also really highlighted in Marie's presentation. Of course, that is very important, right? These are feminized, racialized jobs that are just strongly undervalued. And maybe if one good thing comes out of this of the pandemic, it is that the importance and the competencies that are required for being a care worker come out. And I think there's a role here. So I referred already briefly to trade unions. You see them quite a bit actually in the media. They seem to be discovering a little bit, or at least they now get more attention for this sector. But this is really something where I think a lot of organizations can step in. Yeah, and so I would go into the third question. I would say state oversight is crucial. There's just no other way to organize this sector, I think, in a sustainable and somewhat in a way that also guarantees some equal access. And this can be national state, but it can also be local government. So indeed, it's true that in many countries this is decentralized, which is not a problem in itself. Only often, for example, if I think about the Netherlands, decentralization has also been accompanied by marketization and increased competition and lower wages, etc. So that is where that becomes problematic. But I would say that state oversight is crucial.
Thanks, Franca. Shereen.
Right, so I would agree almost with everything Franca said. In terms of migrants, we are talking about non-British nationals. So we have a lot of people who have, born in other countries but are become British nationals. And even when you come to that definition, it's a very, very mixed bag. So you have lots of people coming through different routes. More increasingly, you have the intra-European mobility, free mobility. So you do have you know, you don't have much of this attachment to the employer. So in fact, previously when we had the work permit scheme, the senior care workers were attached for at least 4 years within the same employer, and that created certain issues. What we've seen from previous research, that actually people tended to stay even if they finish their work permit. So they are either kind of qualified to become nurses and move on to the NHS, which is a, you know, very adjacent workforce, or remain within the sector. Our research actually around European migrants was interesting to show the gender differences. So women tend to, who come to that sector, tend to come with a lot of altruistic motivation. They want to make a difference. They want to do something that is to do with care, to do with relationships. And although there is a lot, you know, big element of finance and remittances, what we found when we talked to men, interestingly, was that it's a side project. So they have other important things going in their lives, and that maybe it is something that they see it as an opportunity, more flexible, which is quite interesting. So a lot of the migrant men we talked to, they saw this as actually creating opportunities that they have more control over the times, particularly if they go as a PA and work with an elderly man, and they can set these boundaries. And boundaries are really interesting because women in our samples at least didn't seem to be able to set these boundaries and set this clear kind of distinction. In terms of low status, I cannot agree more, but I think I'll be a little bit controversial here, that I think a lot of the image and low status link it to the client group as well. So the vulnerable group that we are dealing with in terms of social care, the people who with disabilities, people, older people. And I think if we didn't tackle discrimination and ageism, we're not going to go further with the workforce. They are the two sides of the same coin. And if we go back to things like childcare and looking at professionalizing, for example, childcare workforce, we can do a lot with the elderly care and care for disabled people. And I think the society, and we've done research on that, and the image is there are lots of questions about perceived this is a woman work, and it's thus not valuable and any woman can do it. So it's very important that we can't put a price tag, that sort of kind of silly arguments, and linking it very much emotionally. And, you know, maintaining care work as this boundaries between vocation, you're doing it for the reward, you're not doing it for the pay, and not professionalizing, and also not thinking about who we are serving and who we are caring for. In terms of the role of state, definitely we have to have some clear regulation. We have to have some clear laws and protect the employment and also oversees the market. There has to be some form of flexibility because of the needs of people are changing, and we've seen quite a room for that flexibility, that people need personal assistant to provide various kind of support rather than just care needs or personal care. They provide opportunities for participation, opportunities for jobs, opportunities for training. But this has to be overseen by, by the state, whether it's central or decentralized local. And I do agree that the trade unions have a role to play here, but broader organizations, and we've seen more and more organizations that are specific to different groups of users are taking action. Also, this racialization of the workforce. We know that they're overrepresented again of, migrants or people with Black and minority ethnic groups background. So definitely the state has to play a role, and very clear role. And I think the English or the Care Act places responsibility on the local authorities squarely, that they have to oversee the care provision. How that is done in practice and the impact of COVID on the Care Act as well is quite interesting. And I know there are some studies ongoing looking at relaxing some of these responsibilities during COVID, and whether that would have some long-term implications, we're not sure.
Okay, thanks, Shereen. Marie?
Thanks, Bridget. Sorry, I wasn't sure if you were including me in this, but I will. I did write the questions down, so I will definitely answer those. In the first question in regards to if I can paraphrase, who is a migrant? It depends. It depends on the context. It depends on the situation. It depends on whether you're doing legal policy analysis, whether you're running programs, overseas programs in country, whether you're looking at different manifestations of migration. So it's highly variable. When you're talking about this particular kind of sector, international migration includes, as very clearly articulated by Franca, undocumented and irregular migrant workers. It can include people who may have status, so refugees and asylum seekers, students who wouldn't normally necessarily be considered to be social care workers. But when you're talking about resilience, this is one thing that is really clear over the first sort of phase of COVID-19 is flexibility in regards to legal policy settings is particularly important for systems. And there is a degree of willingness for governments, national level governments, but also subnational governments too, to exercise that in the context of responsiveness. It can vary very significantly, as we know, and different governments will have different tolerance for flexibility. And we've seen that, say, for example, in Portugal, wanting clearly to have a focus on the protection of their population and the support systems for essential kind of migrant workers, regardless of status. So releasing people from immigration detention, regularising people, providing healthcare access and so forth. But what we also know is that Portugal, for example, is probably an outlier compared to a lot of other regimes at the moment. So that's the first question. In regards to the low value of social care, most definitely. I mean, that's sort of very well documented, but my former kind of life in industrial relations and working in the trade union sector and also in federal government in Australia, as well as working in Moscow when I was in Russia and was working for the ILO there. One of the things that really struck me, which is an anecdote, so it's not analysis, but moving in different systems, we become accustomed to, it's like the frog in the boiling water, we become accustomed to just the way that things are done, including along gender lines. And I recall coming from Australia many years ago now, living in Russia and finding that painters, like house painters and so on, it's a highly feminized system in Russia. Now, in Australia, the painters and dockers, a historical trade union, historically, it doesn't exist anymore in the same form, but historically one of the strongest trade unions. Painters, if you want to get a house painted in Australia, you're going to pay a lot of money. But in Russia, it's a highly gendered sort of sector, and it's all women. It's women kind of workers, and they can be women migrant workers as well. Of course, in Russia, it's got a very significant proportion of migrant workers. So that was a real insight into the way that we have expectations around gender and society does not necessarily occur across different systems. And we need to be rethinking this, including from a government policy perspective, both national and subnational. It's about the value systems, and I completely agree with Shereen in terms of not just the migrant workers themselves, but the entire sector and what that means within a society. And you will see, say, if I can put it this way, European, Australian, wealthy Western countries have quite different value systems compared to other parts of the world where you wouldn't find for aged care this type of approach. So we just have to kind of be mindful of how we've got societal constructs that are historical. They're not new. They're often historical, and that we can provide different interventions and policy settings that can bolster and support different sectors, notwithstanding the politics being very difficult. In regards to national governments and regulation, I mean, I've spent most of my time as a migration visa officer and working in policy in government, and there's definitely a role, but that's changed dramatically over the last sort of 30 years. We are seeing, partly because of urbanisation, but also because when people migrate internationally, they're more likely to migrate to a city. to a metropolis, because that's where the employment is. So we are seeing much deeper engagement of subnational governments. And so, for example, the Global Forum on Migration and Development has a mayoral mechanism now, because they're the ones that are dealing with the issue. So of course it makes sense for them to be engaging on migration, international migration, not just urbanisation and internal movements, and also to be offering solutions, including where we've seen, to a small degree, I wouldn't try and overstate it, but we have seen sanctuary city type of approaches where there is tension between a national government and a subnational government in regards to migrants' rights, healthcare access. This absolutely came up during COVID-19, of course, and being able to ensure the protection of their broader population as well as segments of the population who might be undocumented and irregular. I think that again is a strategic trend that is not going to go away. I think if you look at all the data across a long period of time, we're only seeing continuing focus on urbanisation and migration to big cities internationally as well. Thanks.
Thanks, Marie. So we've got just about 10 minutes to do the kind of more specific questions directed at you. So I'm just going to ask you to be brief, interesting though the questions are. So Franca, the first one for you, which is, so one of the your suggestions, one of your conclusions is that migrants can contribute to a resilient social care system if they're in well-protected employment. What happens when the organisation or the institution that is employing is a family? So what happens when it's a family issue rather than imagined as being a principally state issue? Who bears the costs for resilience in that kind of system?
I should answer straight away.
Yes, please. Sorry.
Yeah. So we know, of course, that direct employment by families in general tends to be much more precarious. So the workers there are much more precarious. Now, how exactly this is organized in terms of labor law and social security really differs per country. So in France, for example, you can be directly employed by a family, but still be really formally employed, covered by social security. This is pretty easy, pretty straightforward. So in these kinds of settings, direct employment by a family is actually can be a good job. Whereas in a country like the Netherlands, you're actually legally excluded from social protection if you are directly employed by a family. So there are huge differences across countries, and various countries have worked on this. But I think this is so how you protect workers that are directly employed by families is really a crucial question, where there is a lot of variation across Europe, and where this makes the migrant workers, then often also extra precarious. Now, of course, you should also realize that the reason why migrants are so often directly employed by families is because this kind of circumvents regulations. So in these situations, the reason why migrants are employed is exactly because this is such an informal position. So this is a very difficult dilemma. And again, I think good public regulations are needed to make this also good employment.
Thanks, Franca. Yeah, we could have a whole conference on this question. So Shereen, there's two questions for you. One is from Lucinda Allen. So she asks whether is it clear the relatively high turnover is linked to the high level of migrant workers in the social care sector in London? Are these differences between London and other regions specific to social care, or are they reflected in other parts of the labour market? So that's one question. And then there's another question from Gabriella Alberti, asking whether you can elaborate on the consequences for migrant agency workers as carers formed bubbles with their clients.
Right. Thank you very much. For Lucinda, we definitely see that the turnover rate, it's not a causal relationship. So there is some association. So it might be due to other factors, but definitely in big cities, we've seen higher turnover, lower vacancy rate, where we see also higher level of migrant workers. Now, whether that is different from other low-paid sector or not, I do not think so. I haven't got the hard data, but I know that there has been a few studies which looking at other work like domestic work or maybe low-paid retail, and maybe there are some comparability. But I'm not in a position to say that this is something that is only specific to social care, but this is definitely observed in social care. Gabriela, so migrant agency workers, this is a very good question. So what has been happening that we've seen various reactions. So we've seen agencies which were trying to deploy migrant workers to different families if one family has been, kind of shielding or forming a bubble. But we've seen in general lower intake, and obviously a lot of these migrant and non-migrant workers are working on 0-hour contracts, so they don't usually have any protected hours. So what 0 hours contracts mean that they will be employed according to whatever contract is coming. We've seen people who were able to claim some form of furloughs, but this we didn't see that very much in all migrant or non-migrant workers because of the type of the contracts that would allow the furlough scheme to be applicable. So, it's difficult to answer. So from the very little data that we have gathered, that it has been very variable. And we know that some migrant workers were waiting for an opportunity to go back home because of this situation, and there are definitely implications in terms of loss of income, and not only for them but for the family, because a lot of the some families are reliant on remittances and money transferred. So these are the 2 points. Very quickly, in relation to the previous question about the private family, I just want to highlight some form of the self-employed migrant, which is the status. So what we have seen, there is a lot of variation between users who are funded by the state and thus are formally through personal budget, for example, who formally become employers. And that puts a lot of pressure on the users to protect the contracts and to provide training as well. And one way that we've seen increasingly happening is a declaration of this worker is self-employed, but in reality it's not real self-employment. So there are a lot of things happening in that sector versus family who is self-funding, and they see the care worker as perhaps a domestic worker doing a lot of other things. So I hope that answers the questions, Lucinda and Gabriela.
Okay, thanks, Shereen. And one last question from Marie, from Martina Belmonte, which is, we learned that many social care workers do not use the labour migration admission system, but can or do labour immigration admission policies have a role to play in increasing the resilience of the sector?
I think, even the work that Franca has done and her presentation at the beginning definitely highlights that, particularly as it relates to quality. And I recall Franca's mention there in regards to permanent workforce versus temporary workforce and the issues around the quality of care. So I would highlight that. But of course, from an IOM perspective, it does go to the centrality of migrants' rights. To be in long-term precarious employment in a particular sector is, of course, detrimental to not only migrant workers but also to native workers as well. So, and I don't think we can really distinguish between them, as Shereen has actually mentioned, several times, that some of these are sectoral issues and labour market issues that are then splintered with the migration dynamic. So we have to look at the totality of this, and this is particularly important if we are talking about resilient systems. To be able to talk about resilient systems, you can't just segment off well, you can't effectively, unless you are a politician, for example, you know, engaging in wedge politics. But if you're really genuine about, you know, regulatory regimes and support systems and care for people in your societies, to be engaging in kind of like wedge politics is really sort of unhelpful. So to understand the entire kind of sector, to promote the value of the sector, goes beyond just talking about the kind of migration dynamics. You know, to have workers in workforces providing essential work. This is essential work. This isn't kind of, you know, work that is could be undertaken but maybe could be outsourced or transnational, kind of like, let's do a call center for the social care sector. I don't think so. We have to be kind of really clear about that. So that's then about holding our kind of leaders of different kind of sectors, including in government, national governments, you know, district governments, as well as city governments, to account in regards to the fact that this is essential work, that we do need to be treating workers with dignity and respect and providing security of employment and opportunity. And that's not just migrant workers, but of course it includes migrant workers. So it's about reducing the exploitative practices that can occur in particular sectors. And the irony that that really the issue that COVID has shown us is that, again, getting back to the essential workers, the 3 Ds, you know, the dirty, demeaning, etc., demoralizing kind of work of migrant workers, and yet they are fundamentally essential workers to the well-functioning, basic functioning of our societies. So the more that we can kind of not just advocate this, but really clearly demonstrate this through research, through data, through kind of supporting key sectors, I think is particularly important. And it is, I've talked about strategic issues, but this is a strategic issue that isn't going to go away and is only going to become more pressing the more it is neglected. So I think this is where, you know, your work and the resilience and the hub can be particularly important.
Thanks, Marie. That's a great note to end the session on. Thank you to our speakers. That was really interesting. We could have gone on for much longer. We're going to have a 15-minute break and be back at 4 p.m. Central European time. Thank you.